Point in time, I am delivering the lower splint for the first time. Okay. Will it see?
Yeah, there's one like there's a high back right over here, but otherwise it should be much better, like the left and the right side seem.
You like that, huh?
Yeah.
Sorry. In here, sometimes looks like it gets a little like.
As I take the appliance in and out of her mouth, adjusting it each time, notice that when I insert the appliance, her head and facial movements and blinking greatly diminish. And then when I take it out for the adjustment, they return. And then when I put it back in the next time, they greatly diminish. You breathing better? Okay. Let's see you get up and walk. You think you walk?
That was good. But I wasn't walking especially normal when I came in, just, you know.
Yeah, I didn't see you come in, but were you walking when you came in?
She was walking a little bit funny. Like this.
Okay, turn around. Is that any better at all than when you came in or not?
I think it's a little bit better. I still feel it here, but I'm not. Well, it hurts just as much. I'm not quite as wobbly, I don't think.
Okay. Walk back over there. Many of these patients also suffer from low back or sacroiliac pain. This is due to sustained muscle contraction in this area. The patients invariably experience relief of these pains due to these appliances we make. We judge the effectiveness of the appliances by how they walk initially. Any improvement of the walk occurs in the first 2 or 3 minutes and then continues thereafter. And it gives us an idea of whether we're on the right track in the treatment of these patients. Believe it or not, this is an improvement in her walking. If you did not discern any noticeable difference, notice how her walking completely degenerates when I take the appliance out of her mouth. Not as good, is it?
I feel shakier.
Okay, I'm going to add to this. I have increased the vertical dimension 3 times in fact, on this patient. You seem to get out of the chair a lot easier. Okay, turn around. Okay, let's leave it like this for today, and this should improve. Practice walking backwards at home, you know, not picking the ears. Do that like 5 or 10 or 20 times a day, you know, 10 feet across your living room or something. And people seem to adapt to it, improve quicker with practicing walking backwards.
Okay.
And,
Okay, this is the next day. Go ahead and tell us how you're feeling.
I'm feeling really well. Yesterday I went home and just napped for a little bit, and when I got up I could walk much better, more steady, and my low back pain was mostly gone. And I could do a little bit, like just leaning that little bit forward and back that normally kinks me up. I could do that, which was really good. And this morning I'm walking really well and sturdy, and my neck has calmed down. So, and I can actually I can look up and down, which normally, makes me twitch a lot. So.
And no spasming?
No. If I take this out, it will spasm, but this is pretty good for me to be able to lift my head up that far.
Okay.
And I don't have any, I'm walking pretty evenly.
Okay.
So really good.
Good. Let's see. So your hands aren't shaking anymore?
Nope.
Your feet?
Nope. I can hold my head up by itself.
Okay, go ahead.
Keep in mind that these results were obtained within 24 hours of her initial appointment without the use of medications or psychological therapy to suppress her symptoms. We are trying to treat the prime cause of her symptoms, which will be revealed to you as we go through this DVD. Okay. Her opening has increased to 46 millimeters. Yesterday it was 41 millimeters. That's a 10% improvement just like that. We're going to do a final adjustment and then send this young lady back to Cleveland. Jump shot. Okay. This is the final splint configuration. Okay.
Wonderful.
6 or 8 weeks, sweetie.
Yep, we got 6 weeks planned.
Okay.
Already in the book.
Good.
Thanks, you guys.
Bye.
Remember her initial appointment when you saw the MRIs hanging on the view box? These are MRIs through the left and right temporomandibular joints in both the closed and the open positions. The big question is, what did they reveal? Because you recall I told you that most of these patients were both Tourette's and internally deranged TM joint patients. And although we have addressed the Tourette's symptoms, it is not sufficient, in my mind, to do just symptomatic treatment. You have to address the prime cause of all the symptoms. It is now time to address the Tmj symptomology. The MRIs reveal that the discs within each joint were anteriorly dislocated without reduction. That means they were displaced to the front and did not go back into place upon opening of the mouth. This is why it hurt her to open and why her interincisal opening was limited. Although you may think 46 millimeters was a normal opening, to me it is an impairment of function. The normal opening should be 50 to 54 millimeters, in spite of what you may have been told by other people. So therefore, we now address the internal derangement, and we do this by open joint plication surgery. It has been my experience over the past 45 years that if you address only the symptoms without the TMJ dislocation, the treatment will have no stability and the symptoms will return within 1 to 3 months. Therefore, to provide long-term stability in the treatment of these cases, we must get the left and right displaced TMJ discs into their normal anatomical position in such a way that they stay there. And we do this through left and right open joint TMJ plication surgery. Those of you who are healthcare providers should know that it takes a very courageous patient to proceed with this step of TM joint surgery, because they have experienced such an improvement in their symptoms that they are afraid that they will risk losing this improvement if they go on to this additional treatment. To me, this is an irrational fear. It will only improve them if the surgery is done correctly. This is the patient 3 days post-surgically. She had a left and right open joint plication procedure. I've reviewed with the patient what her presenting symptomology was, and she's going to tell you the improvement.
I feel great. I'm surprised at how great I feel I can move without tremoring, and my back and my neck are not hurting. I can do the opening of my mouth without tremoring. When Dr. Stack was just measuring me and taking my appliance in and out, my head wasn't shaking, my arms weren't quivering, and I'm not in pain. I've been in pain for a very long time, so I don't even know how to explain it. It's really wonderful. Do you want specific?
You had trouble walking, right?
I had a lot of trouble walking.
Okay, why don't you get up and walk out there and then back, and we'll just...
I can get up and down without using a cane or a walker, and I can walk
Okay, see that?
with a regular stride. I don't feel like my thighs are pulling on my back anymore, and I feel like and my neck isn't sore just like all the time. Usually it's hard for me to just hold my head up.
Okay, do it one more time up to that. Lay it back.
What's the difference likely to be when she's off medication?
Even better. Even better.
Getting really much
Yeah.
better. Oops, if my chair's moving.
Okay.
Yeah.
Okay, we are rebalancing the patient's surgical splint to compensate for any spasm, muscle spasm, swelling, etc. And then we'll dismiss the patient and see her in the near future.
Right after surgery, I have been just amazingly better. I had, for the last 10 years, I've had pain, constant pain in my back, in my neck. I've had debilitating migraines. I have walked bent over funny. I tremored. My tremors got so bad that I couldn't stand right. I was using a cane. Sometimes I've been sleeping on and using a massage table. I haven't sat on a couch in like 10 years. I have been through every physical therapy, back surgery, steroid shots, pain blocks, everything, and nothing has worked. And the surgery, since I woke up from surgery, I could stand up, right up. I always used to have to push myself up with my arms, and I would be shaking. I couldn't look up in the air or to the side with my head, and I would blink like crazy, and my head would twitch to the left, and my husband would have to carry me around and get me up and down the stairs, or I couldn't go. I was homebound a lot. I couldn't drive a lot. I had trouble attending things, like just having trouble, going to my family's weddings and things. So I was very non-functional. And since the surgery, I can walk. It's not pulling on my back. I don't have constant back pain. I don't have constant neck pain. I stride normally. I have had no tremors at all. None in my hands, none when I'm moving, so I can move up all the way, and that would normally make my whole body tremor, and I can look to the side, and I can stand and sit without having any trouble with my back, without using my arms to hoist me, and I'm walking upright, so I'm going to be able to get stronger, because a lot of my muscles didn't work the right way. From so many years of compensating, so now I'm just working on strengthening and getting the proper muscles to work. But it's truly amazing. My family, my doctors can't believe it. They're so excited, and I feel happy. And they say I'm like I used to be. My face and my movement, and it's just so nice not to have constant pain all the time and feel like I can't even get around my own house. So. I don't need a walker. I've used a wheelchair, and I haven't used that or my cane or anything since surgery. And
if anything to add, he hasn't had to carry me anywhere. So it's been wonderful. I'm really just excited to keep getting better.
After treating her with great symptomatic improvement, we recommended that she have bilateral TM joint surgery. The left TMJ disc was displaced with 40% of the disc anterior to the articular eminence. The disc was abnormally thin. The surgeon placed the disc in its normal anatomical position and sutured it in place. The right disc was displaced with 20% of the disc anterior to the articular eminence. The right disc was also significantly medially displaced, but in good condition. The disc was placed in its normal anatomical position and sutured in place. This is a Parkinson's patient who was diagnosed 14 years ago. She's been on Parkinson's medication for 13 years, and they are losing their effectiveness. It's been my experience that this is a very common happening after being on the medications for several years. She had a deep brain stimulator implanted 2 years ago, and she says it does no good because her physicians cannot find the proper settings. This is a very common thing that we hear from these patients. In fact, in the last month, we've had 3 or 4 patients come in with deep brain stimulators implanted that are not working. This is not an unusual occurrence for us. To complicate matters further, she was diagnosed with head and neck cancer 12 years ago. She was diagnosed and treated for TMJ problems 16 years ago and wore a mouthpiece for 3 years. We always take a CAT scan report on these patients. Always, always, always. And I've never seen a Parkinson's patient that did not have TM joint pathology. And we document each and every one of these patients with an MRI report. When they have a deep brain stimulator implanted, it's very difficult to obtain an MRI. And so we use a CAT scan, which is what we did on this patient. And a CAT scan report came back showing the following pathology: flattening of the rounded left condyle with erosions in the articular cortex, cortical erosions of the left articular eminence, narrowing of the left temporomandibular joint space, osteophytes on the anterior and posterior surfaces of the deformed left condyle, erosions of the right condyle, erosions of the right condyle's articular cortex and the right articular eminence, osteophytes on the anterior surface of the right condyle, narrowing of the left TM joint space. These changes are due to degenerative arthritis, worse on the left side. In examining the patient, we noticed that she had a deep bite of approximately 80%, which means that upper teeth extend down, covering 80% of the height of the lower teeth. Her mouth locks shut. She has difficulty swallowing and chewing, difficulty turning the head left or right, right neck pain, right shoulder pain, and insomnia. This is a Parkinson's patient who has had a deep brain stimulator implanted. You can see the wires running down the side of her head, down her neck to her chest. The deep brain stimulator does not work. No one has been able to find proper settings for it. Again, evaluate the cranial distortions present in this patient by the discrepancy in the positions of her mastoid processes here on the left side compared to the one on the right. This one is out and this one is in. Again, note her deviated nasal septum. This is the lateral head x-ray of this patient. You can see the wires from the deep brain stimulator running down her cervical spine into her chest. The only thing this woman has that is a real big asset for her is the size of her airway. This is a fantastically wide airway and will serve her well. This is this patient's submental vertex x-ray. It again shows the wires of the deep brain stimulator here and running down the side of her head, down her neck. It also indicates that she cannot extend her head posteriorly, because if she had normal extension of the head, the upper teeth right here would be at the top of the film, right up here. But this is the patient's best effort at extending her head, and you can tell just from the x-ray that she doesn't have normal extension. This is the patient's right temporomandibular joint images showing that there is no distal skid between initial contact and full occlusion. But notice that it shows an osteophyte on the anterior surface of the condyle right here. When they're pointed like that, that means they're made of osseous material as opposed to cartilaginous material. This is this patient's panorex x-ray, and I show it to you to show that frequently most dentists do not look in the TM joint area. But if you look closely, you can see that she has very narrow, if any, superior joint space on both sides of the film. That should immediately lead you to believe that this patient's mandible is malaligned and or a disc or both discs are out of place. These are two views of the right TM joint in the wide open position. You notice the lack of superior joint space right there. Notice the hollowing out of the posterior surface of the right condyle. Whenever you see something like that, suspect a space-occupying lesion applying pressure to the back of the condyle. This is a coronal view of the left and right condyles. You can see that the left condyle is eroded on the lateral surface here. This is a CAT scan image, not an MRI image, due to the strong magnetic field in the MRI running the risk of dislodging the metal parts of the deep brain stimulator. This is the right TM joint closed CAT scan showing a good image of the osteophyte on the anterior surface of the condyle. This is another coronal CAT scan of the left and right temporomandibular joints, and you can see what appears to be medial osteophytes also on both condyles. This is a patient who was diagnosed approximately 13 years ago. Give us a little bit about your history of this disease.
Well, at first, the first signs of it, I started to have a lot of trouble walking. I had a real stiff neck, and well, those were primarily the main symptoms. I had a very stiff neck for a while, and then I started having trouble walking. I couldn't swing my arms. When I was at work, I'd walk down the hall and I'd bump into the walls. I'd kind of have to use the wall to help me balance myself. I would start going forward and wouldn't be able to stop, and the same thing would happen. I'd just start going backwards and I couldn't stop either.
Okay.
I didn't have much of a tremor, but I do now as the medication's effectiveness is getting less.
Okay. The medications worked at first?
Yes, immediately. I took one pill and it was like I didn't have Parkinson's anymore.
And now it's 13 years later?
Yes.
And the medications aren't working?
No, I take it every 2 hours, and sometimes it works and sometimes it doesn't.
So they're losing their effectiveness?
Yes.
Yeah, okay. And then 5 months ago you had a deep brain stimulator put in?
Yes.
Yeah, tell us a little about that.
Well, it was a lot more involved in it than I had really expected, but I did get through it. You have to have the wires put in one surgery, and then about 2 weeks later, or I guess a week later, I had a battery pack put in my abdomen. And then you start going to the programmer for, for them to set the, I don't know what you call it, but the settings. They go like 1.8. Right now mine are both set at 2.2. But every time they've tried to put my settings up higher, I'll go home, and after a while I need to put it back to what it was before, because it's just, I get stiffened so badly. And that's about how it's been so far.
Okay, so basically they haven't found the right settings for you yet.
No.
Okay, so you've come to us and you want to try the mouthpiece to
right, because yes, and another thing, I've had TMJ symptoms off and on since about 1986, 87.
Okay. Show the viewing audience how wide you can open your mouth. This is 28 millimeters. Get me a ruler. What's it show here today? Okay. 28. Okay, that's her maximum interincisal opening. Now, bite down. See, she's got an 80% or more deep bite. Why these two clues were missed is beyond me. But this, I feel this TMJ problem is contributing greatly to her Parkinson's. Every Parkinson's patient I ever met has a TMJ problem. Okay, we're going to deliver her appliance a day or two from now, and then we'll monitor her progress as she goes along, and you'll be able to see her response. Do you still have trouble walking?
Well, yeah, when I get stiff because the medication isn't working, yeah, I have, when you're stiff, it's really hard to walk, yes.
Okay. How about today?
No, today I've been okay. My primary symptoms, even on off meds, are mostly from my neck up to my head lately. They seem to have changed since I had the DBS.
Okay. Today is the delivery appointment of this appliance. Notice the patient's deep bite, and how the first thing the appliance is going to do is correct the deepness of the bite. Open. Bite. Now with the appliance in, you can see that the teeth do not overlap and the deep bite is gone. Tap up and down. Okay. This is the initial position we're going to leave the appliance in. We have balanced the appliance already and it's hitting evenly on both sides. She has 1 point contact on the left and the right side in the upper first molar area against the flat plane on the left and the right sides of the lower appliance. We are going to see this patient in 3 or 4 days for her first checkup, and we'll show you the improvement between now and then. Okay, this patient returns after wearing her appliance for 5 days. We've adjusted it, and she just told me that for the first time last night she slept for 7 hours, which is highly unusual. She usually sleeps for 4 to 5 hours maximum, but now that her duration of sleep is starting to increase, which is a common thing that we hear from these Parkinson's patients. We'll see her next in 6 weeks from now, and we'll bring you her improvement at that time. This is a Parkinson's patient who's had her lower appliance for the past 6 weeks. She had a deep brain stimulator implanted. How long ago was that put in?
In October 2010.
And they've never been able to get the settings right on it, right?
Actually, up until a couple of weeks ago, that's true, but they finally got some good settings for me.
Okay.
And they're working really well. In combination with the TMJ and everything else, it's starting to kind of fall together.
Okay, but When we gave you your appliance, they did not have the settings.
No.
Which is why you got the appliance.
Yes, at least, yes, partially.
Okay. And when we put the appliance in, you had hat band headaches 1 to 2 times a month
Yes,
for several years, and your big thing was insomnia, trouble sleeping.
yes.
And you, at that time, you could only sleep, what, 2 or 3 hours a night, or?
4 or 5 maybe, and then I'd get up and it was like a split shift of sleeping.
Okay, and now you're sleeping how much now?
Sometimes 7, 8 hours.
A night?
Yes.
Okay. Let's see, you had facial muscle tightness.
Mm-hmm.
Your mouth